Yesterday, my ex-husband and I had to do something as parents that I'm sure at some point every person has said they would never fucking do, ever. Pretty sure we probably said that at one point. But with multiple teenage boys in our houses, we get humbled often by what we thought we knew when they were little or before we had them. Our mental health care system is broken. That's not a secret. At least I hope it's not to anybody, because if that's news to you, you've been living under a motherfucking rock. We've been fighting against a broken system for a year to get help for one of our kids, well, for all of our kids, but two really in particular. One more urgently, I guess. It was made painfully clear to us in December when we took him to the hospital because he was suicidal that your hands are tied. There's too high of a demand and too few providers to take care of all of these kids who need mental health intervention. The way it was explained to me by someone I know and trust very well and is painfully accurate is you gotta wait. You gotta wait the months, sometimes year or more, for the appointments. There is a workaround. However, my son falls in between every single possible crack that exists in the pediatric mental health system. When we took him to the hospital, he wasn't not quite suicidal enough. Yes, that's the thing. He told them he would rather be dead. Passive suicidal ideation is not enough for inpatient treatment. I can understand that as someone who has passive SI. Still infuriating as a parent and fucking terrifying. So basically it was explained to me, in order to get around all these fucking loopholes, these kids have to be either actively homicidal, suicidal, or in handcuffs. So yesterday my ex-husband and I decided it was time to take the final, most drastic route and attempt the handcuffs. He's never been in trouble before. Since he's never been in trouble before, he's not high risk. But he is high risk because we're trying to prevent that from happening. I'm going to have to make a part 2.